I am Wilma Schroeder. I'm a nurse and family therapist, and I teach family nursing at Red River College in Winnipeg, Manitoba, Canada. My background is primarily in mental health, and I have a special interest in families living with schizophrenia. I've had a private practice in family therapy, and currently I'm teaching full-time. As an educator, my primary focus is on family nursing, and I really aim to emphasize skill development as opposed to content memorization. In 2010, a new baccalaureate nursing education program was introduced at my college, and at that time we formed a family nursing course. The new program is founded on the philosophy of relational nursing. I was finding that students had difficulty really grasping what relational skills were and understanding them and putting them into practice. At the same time, I had been to a conference on patient and family-centered care where they talked about the power of using family stories and families as what they call faculty in educating health professionals. So I had a meeting with the patient safety coordinator at the Winnipeg Regional Health Authority. Her name is Wendy Singleton. And Wendy and I developed a collaborative family lab where members of the Winnipeg Regional Health Authority's Patient and Family Advisory Council come to my class to tell their stories. This has proven to be a very powerful class, and the students consistently say that it's the best class they've had. So one of the things that's important in organizing this is to prepare both the family members and the students for what's going to happen. So the students are given some instruction on what is relational nursing, what are the relational nursing skills, specific direction as to what I want them to do, which is to listen. They are to practice relational skills of listening to the family story, listening for what has meaning and significance to the family, trying to get in sync with the family, to think about collaborative knowledge development, but mainly just to hear what the family member has to say without defending the healthcare system or trying to explain it or anything along that line. This goes really well. Usually we find the biggest feedback has been from everyone that there's not enough time. So I'm actually going to expand the time for the storytelling. Following the storytelling, we have a debriefing where everybody talks about what was meaningful for them, and the students do an evaluation form for the WRJ's council. They're compiling the results for me. I have to say that it's been interesting. The implications seem to be that it's so powerful to hear from the family. Students have said things in the evaluation such as, "No offense, Wilma, but you could tell us this stuff all day and it doesn't mean anything. But when we hear these family stories, now we get it." And in the debriefings, it's very interesting how often when I ask what they have learned, they are telling me things I have been trying to tell them, but now they really, really do get it. From the family's perspective, they find it very tiring, but very rewarding. And they say that it's really meaningful for them to be heard by the students and to feel that they are contributing to nursing education. So ultimately, what I'm finding is that the best way to teach relational nursing is to actually do it with the students and with the families as partners.